There are a lot of mixed messages available on marijuana use, its harms, and legalization. Determining fact from fiction is not always easy. This video is part of an ATTC Network Coordinating Office multimedia package to provide you with straightforward, accurate information and resources from leading scientists and trusted sources to enhance how you address marijuana issues in your work. This fourth video of the Marijuana Lit series explains what is meant by medical marijuana, who uses it, and why. The difference between medical marijuana and FDA-approved medications, and legal issues related to medical marijuana.
I'm Dr. Tom Freese. I'm the Director of Training at the UCLA Integrated Substance Abuse Programs and also the Director of the Pacific Southwest Addiction Technology Transfer Center. Well, we know that marijuana has been being used recreationally for a long time, and some of the same properties that make it effective as a recreational drug also seem to work and help it work as a medicine. So as a medicine, it can do a variety of different things. For people who are taking medicines or have issues with ongoing nausea, marijuana can help to alleviate some of those kinds of symptoms. It also works pretty well for a variety of different kinds of pain, but particularly neuropathic pain, like neuralgia or neuropathy that happens either on its own or as a condition, as a side effect of some of the treatments that we offer people for a variety of conditions. Marijuana also helps to calm and relax people, and so some people purport that it works really well for anxiety. We have a lot less research on those kinds of conditions than we do on nausea and pain, however, and so we need to be really careful as we think about what we recommend medical marijuana be used for if it is going to be recommended. There are a number of clinical trials that are going on around the world that are looking at marijuana as a treatment for a variety of other conditions: multiple sclerosis, sickle cell anemia, pain from a variety of cancers, some seizure disorders. And our hope is that those clinical trials will be able to help us pinpoint the specific conditions that marijuana is most effective for. There are pharmaceutical medications that have been approved by the FDA that contain the same active ingredient, THC, that's in the plant form of marijuana. Currently in this country, we have a couple of medications that have been approved. One is dronabinol, which is sold under the trade name of Marinol, and it's FDA approved for the treatment of HIV. But it is used off-label for symptoms related to cancer and cancer treatment as well. The other one is nabilone, sold under the trade name of Sesamet, and it's FDA approved for cancer treatment, but again is used off-label, which is perfectly legal, for the treatment of HIV. If you're using something off-label, the care provider just needs to make sure that the benefits of use outweigh the risks associated with use and that the person is totally informed. When you smoke marijuana, it goes almost immediately to the brain, which gives a very rapid feedback mechanism. So you know if you've used enough to meet the conditions that you're using it for. That feedback mechanism may lead to slightly lower dosing for people who are smoking it. Whereas the absorption, when you take it orally, either the plant form or the pills, is a little more erratic as it goes through the digestive system, and it takes longer, up to an hour potentially, for the feedback to be there. So it's a little harder for the user to figure out, have I used enough or not? There are also chemicals in the plant form of marijuana that dampen a bit of the effects of THC, and these are not in the pharmaceutical medications. And so actually people may experience a larger high when they're taking the oral form of the medication rather than the plant form of the medication. On the other hand, the pharmaceutical medications, the pills that contain THC, are FDA regulated. They've gone through formal clinical trials, and the dosing is always standard. So you know exactly what you're getting. With the plant form, we don't get that. The FDA isn't overseeing it at this point because federally it's not seen as a legal medication. So we don't necessarily know if there are any adulterants or pesticides or anything else in the plant product that we may be also taking into our bodies. People who use medical marijuana kind of run the gamut of society. A lot of different people are interested and actually use medical marijuana and the dispensaries. In a study that my colleague Chris Grella at UCLA did in 2013, she went and interviewed a bunch of users of medical marijuana and found out some interesting results. One thing she found is that the majority of users of medical marijuana had histories of using marijuana before. So they had used recreationally, and then when they were looking for something to treat a particular condition, they turned to marijuana for that as well. So they kind of evolved from a recreational user to a medical user. There were also a number of other people in Dr. Grella's study who indicated that they used marijuana because they felt like it was more effective than their prescription drugs or had fewer side effects. Almost 60% of them said that marijuana worked better for them than their prescription drugs. And many reported that they had less side effects and felt better overall when they were using marijuana than whatever their prescription medication was.
At the time this video was produced, 23 states and the District of Columbia have passed laws that allow for the use of marijuana for certain medical conditions.
These state laws, however, are in conflict with the federal law. According to the federal government, marijuana is still a Schedule I drug, which means there are no recognized medical uses for marijuana. So as a Schedule I drug, you can face federal penalties for possession or use of marijuana, even if you're fully in compliance with state laws. It hasn't happened very often that people have been prosecuted under federal law when they're in compliance with state law, but it is possible. So it's critical for providers to understand the laws within their own jurisdictions and to help the client plan how they're going to manage their medical marijuana to reduce the likelihood that they'll get into any kind of trouble with it. So in summary, there is evidence that marijuana is effective for some medical conditions, and as research continues, I think we'll continue to see more evidence. There's a real need to bring state and federal law together and figure out how to deal with this issue in a real way, and hopefully gain the kind of FDA oversight that we have with other medicines to make sure that as people are taking this, that it's good for the indication that they're taking it for, and that it's safe for them and as effective as possible with as few side effects. In the meantime, I think we'll see more of these medical marijuana laws pass in other states, and I think as we monitor what's working and what's not in the states that have legalized medical marijuana, we'll learn a lot so that we can make sure that it's being implemented as safely and as effectively as possible.
Be sure to check out the complimentary ATTC eye training, Marijuana Sifting Through the Myths by Dr. Kevin Hill, author of the book Marijuana, The Unbiased Truth About the World's Most Popular Weed. The fifth and final video in the Marijuana Lit series talks about the shifts in policy among various states and the possible need to address the growing impact and consequences of these policy changes. If you have thoughts on this topic or would like to hear what others are saying, join the Network of Practice online discussion. Visit www.networkofpractice.org, create an account, and log on today. For more information, please visit the ATTC Network website, www.attcnetwork.org.